It's my feel-good breakfast show.
Welcome back. You're tuned into your Feel Good Breakfast Show. This is Expresso only on SABC3. Now, September is Physio Awareness Month, and this morning we're going to be finding out a little bit more about this type of therapy. Now, physiotherapists help people restore movement and function when somebody is affected by injury, illness, or even disability. And we have our physiotherapist, Anthony, with us this morning to give me some advice on dealing and also training with injury. But before we get into that, take a look at this quickly.
Physiotherapy dates back thousands of years, from the era of Hippocrates all the way to its official registration in the 1800s. It's been used to address severe and minor medical conditions and helps the body return to optimal functioning.
In essence, physiotherapy is an applied discipline dedicated to the study of human movement and function and how it relates to the quality of life and well-being.
Physiotherapy treatment can be used to assist all ages, from neonatal infants to those in their senior years. The type of treatment will depend on the nature of the problem and can vary from stretching to specialized electrotherapy. Sports professionals make the most use of physiotherapy, like javelin thrower Rocco van Rooyen, who has treatments both in and off season.
In javelin, you get injured a lot, or it's at least a very unnatural movement, so your body tends to take a lot of punch. In season, I would come about 3 times a week, and then we would maintain off season as well. So it kind of depends how the body is feeling, but I would want to come to see him as often as possible, just for me to maintain a good, healthy body, basically, while throwing javelin.
Some physiotherapists acquire a certain level of fame. Rob Swire was the physical therapist for Manchester United for 15 years and treated Wayne Rooney's injuries. He also created an injuries database for the club to fine-tune training and treatment for each player. Sarah Key has been physiotherapist to the royal family for almost 30 years and helps to maintain the Queen's physical health.
4 basic tips to take into consideration for good posture is not to lock your knees in a standing position. Secondly is to activate your tummy muscles and draw it back towards the spine. Thirdly, stand in an upright position and raise your sternum. And lastly, rotate your shoulders back and keep your shoulders in a relaxed position.
If you want a better posture or some help in healing that sore back, best you pay a visit to your physiotherapist to enjoy the freedom of healthy movement.
Well, there's a bit of a roundup as to the work of physiotherapists. Now, like I said earlier, Anthony joining us this morning, physiotherapist. Dude, thank you so much for coming through and just helping me out with some issues this morning, because let me tell you, I mean, I'm sure you guys don't sit with a lack of work. I mean, injury is kind of an everyday thing. So here's the thing. I recently signed up to get into the boxing ring for a good cause. The thing is, I don't have any fighting background, and my body is not conditioned to the type of training. So I'm sitting with a bit of a short shoulder, especially on the left-hand side, because it's kind of the leading arm, you know, when you go into a match. What would your advice be in terms of still being able to train with this injury, because I cannot lose ground?
I think it's important where you want to stay active, but also you want to make sure that you don't re-injure your shoulder once again. So it's all about putting those systems in place to prevent injury. I think it's important, one, to identify 3 things. What is the diagnosis? Secondly, of course, the structures involved in your particular condition. And thirdly as well, in which healing phase you're on at the moment. Yeah. And of course, secondly, where that is concerned is your recovery period. You need to, of course, have an adequate recovery period to allow the soft tissue or the injured areas to, of course, go through its healing process. Taking consideration as well, you need to do some form of rehabilitation, which is important. A lot of athletes, a lot of sports people don't particularly take on a rehabilitation process, and therefore they tend to be more prone to injury. And of course, it's important, of course, to prevent that further injury or reoccurrence of the injury with regards to strengthening your physical condition, and with regards to exercises such as stretching exercises, strengthening exercises, core stabilization, proprioception and balance activities, and also making sure you've got good range of motion in the shoulder.
But like you say, I still have the range of motion, but why I say you need to rest. You need to be able to rest the injury, because I think this is the problem when it comes to a lot of sports people, is you want to recover very quickly because you want to get out in the field. Now, this is what I want to ask you. What are some of the common mistakes that people actually do make that causes injury? What should people be aware of from your point of view?
I think, of course, seeing that summer's basically on the horizon, and people tend to get very enthusiastic, want to be active in the summer period, but however they make a lot of mistakes when getting into the activity. We can break it down to 4 basic points. One is overtraining. We have a tendency to do too much too soon, and of course knowing that a muscle that is fatigued, it does poor work. So it is important to give a particular muscle or a group of muscles enough and quite adequate time to recover. And secondly, of course, is undertraining. So if you have a particular area that is weak, and you have the expectation, of course, to put that muscle group or those body part under too much strain, and it can't basically cope with the demand of the sport.
Now, when it comes to some key points for people out there from a physiotherapist point of view, what exactly can you do? How can you help people to completely prevent injuries? What would you say to them, just in summary?
Okay, so it's important, of course, as a physiotherapist, we're big on form, and we're big on mechanics and biomechanics, basically, how you go about executing a certain activity or your sport. It's also important, of course, to take in consideration if there's any equipment involved, that we would give advice to make sure that you've got equipment that's well fitted and individually suited for the person. As a physiotherapist, we're quite big on doing hands-on work. So just to basically promote the healing process, it's important to help just speed on the repair and the strengthening of those particular soft tissue injuries that you have, as well as prescribing, because there's been a big basically shift from hands-on work to prescribing exercises for the patients and athletes. So we would automatically give exercises that help with improving your strength and your core stability in a particular area that you have a complaint of, as well as proprioception and increasing and maintaining good range in that particular area.
Perfect. Anthony, thank you so much for joining us. And I mean, it just goes to show it is so important when you do have an injury to come and see a professional like yourself, because you can really have some, get some really good advice. I mean, it is Physiotherapy Awareness Month, and these guys really help us out to make sure that our bodies can perform at that peak condition. Next up, though, from physiotherapy and injuries, we're talking skin and how to get glowing skin, but you need to firstly assess what is your particular skin type.